Today's topic of discussion is septic arthritis. It is also called as infectious arthritis. Septic arthritis refer to any joint inflammation caused by microbes. Usually it result from a bacterial infection of the all type of joints. So septic arthritis, inflammation any joint caused by microbes, mainly bacteria. It can affect all type of joints, fibrous, cartilaginous, fibrous, cartilaginous and synovial joints. So it can affect all type of joints. So let's discuss about synovial type as an examples. Yes, synovial joints consists of a joint capsules which an outer fibrous layer and inner synovial membrane filled with synovial fluid. So that synovial joints outer fibrous layer and inner synovial membrane filled with synovial fluid. The synovial fluid is a clear viscous fluid that look like white of egg and it helps lubricate the joint and absorb shock. So here we are discussing synovial joint. The joint consists of capsules which an outer fibrous layer and inner synovial membrane filled with synovial fluid. That synovial fluid is a clear viscous fluid look like a white of an egg. This one help for lubricate the joint and absorb shock. The synovial membrane has blood vessels. So it have blood vessels that supply the joint with nutrient and oxygen. The synovial membrane has blood vessels. What is the role? Supply nutrient and oxygen to the joint. The tips of the bone that comes together to form the joints are covered by an articular cartilage, which is an slippery smooth layer of cartilage that also absorbed shock and reduced friction during movement. So tip of that bone that comes together to form joints and covered by articular cartilage. It can also absorb shock and reduce the friction during movement. Now, there are the various ways that bacterium can get into our joints. What are the way? First, it can be formed from a free existing infection in adjacent tissue. Usually the bone from where a bacterial infection can spread to articular part of that bone, then make it way right to the joint. So first way, free existing infection in adjacent tissue. Through tissue it will enter to bone. Second one is through, it can travel through bloodstream and get into the joint. So first one is through tissue, second one is through bloodstream. After that, through dirty particles, through broken skin, organism will enter, then it will reach to joint. So first one is through adjacent tissue, second one is through blood, third one is through broken skin, it will enter. Bacteria would either come from the nail or be living in the environment through broken skin or through the environment. What are the bacterium will enter? Clostridium tetani, which causes tetanus. Disease name is called as tetanus. It would be bacteria that lives on the skin surface and get push deep into the joint at the moment that the skin is pierced. When our skin having broken, that time through um, broken skin, surface of the skin, Clostridium tetani will enter. Then Staphylococcus aureus. Once the bacteria get into the synovial cavity, they start destroying the articular cartilage with their toxin. First, Clostridium tetani through broken skin will enter. Second one is second bacterium, Staphylococcus aureus. Once it will enter to our synovial cavity, means it started to destroying that articular cartilage by using the toxin. Then one of that example of the toxin, chondrocyte protease. This one is the toxin which is the powerful enzyme, okay, which is the powerful enzyme that is capable of digesting that collagen in the articular cartilage, Also, bacteria presented with pathogen associated molecular pattern, PAMPs, which is a group of bacterial surface antigen that are recognized by our innate immune system as foreign and result in the initiation of an immune response. Macrophages can spot bacteria by their PAMPs. They phagocytose them and at the same time released cytokines such as interleukin 1 and tumor necrosis factor alpha. So what are the bacterium? Clostridium, Staphylococcus. After that bacteria presented with the pathogen associated with the molecular pattern PAMP. It is a group of bacterial surface antigen. This one will initiate what it will recognize our innate immune system as a foreign, as a result initiation of immune response. After that macrophages spot by their PAMP, then here phagocyte process will occur. After that they are releasing cytokines such as interleukin 1 and tumor necrosis factor alpha. So these are the these two things that interleukin 1 and tumor necrosis factor alpha, these are the signaling chemicals that recruit more immune cells to the site of infection. Also that PAMPs get recognized by mast cell and they released histamine which causes vasodilation and increased vascular permeability. So these two signaling chemicals recruit immune cell to the site of infection. After that this PAMP get recognized by our mast cell, then they releasing histamine which causes vasodilation and increased vascular permeability. As a result, final result, more blood comes into that area creating an inflammatory response. So more blood come to that area which makes joint look red, swollen and warm as more fluid leak out of that capillaries and accumulate in the joint space. Why means here more fluid will accumulated, leak out of that capillaries and accumulate in the joint space. There is an increase in the intra-articular pressure and interpreting blood vessels supplying in the joint. Eventually, it leads to necrosis of that affected bone and cartilage, leading to joint destruction. So more blood will come to that inflammatory area, which causes red, swollen and warm. Because that fluid accumulated in joint phase, then it will increases that intra-articular pressure, so compressing blood vessels, so it leads to necrosis of that affected bone and cartilage, so leads to joint destruction. What are the symptoms? People with septic arthritis develop joint pain, impaired range of motion and fever, but symptoms may differ from person to person and according to their underlying pathogen. Based on their pathogen also it can vary person to person. So first example, gonococcal arthritis, which is caused by Neisseria gonorrhoeae, usually affect sexually active adolescent. The bacteria typically spread homogeneously, so it will spread through blood and spread from initial infection of that cervix, urethra and pharynx. Neisseria gonorrhoeae affect multiple joints and also causes multiple skin lesion and tenosynovitis, which is the inflammation of that muscle tendons. Tenosynovitis. Tenosynovitis, inflammation of muscle tendons. Now that majority of septic arthritis is not due to Neisseria gonorrhoeae. It also called as non-gonorrheal arthritis, include all other pathogen, but most of them a single joint will be affected, typically a knee. Non-gonorrheal arthritis is most often caused by Staphylococcus aureus, which can completely destroy the joint within a day unless it is treated. We don't take treatment means within a day it will affect that joints. Bacterial causes include multiple streptococcal species as well as Mycobacterium tuberculosis, Fortella species. So non-gonococcal arthritis caused by Staphylococcus aureus, Streptococcus species, Mycobacterium tuberculosis, Fortella. Fortella which causes Lyme disease also. Then a diagnosis of septic arthritis, starting with obtaining synovial fluid from the joint, using which is done by doing joint aspiration. Synovial fluid by joint aspiration, where a needle is placed into the joint and fluid is aspirated or drawn out. That synovial fluid can be sent to further analysis. Typically, there is a high WBC count, then positive gram staining and positive culture, which identified that extra causes in addition of imaging in the form of X-ray, CT scan, ultrasound, then MRI can also very useful in demonstrating bone erosion and joint effusions, especially hip or sacroiliac joints. Finally, treatment of septic arthritis typically started with antibiotic therapy and pain medications. In addition, it may require joint aspiration and washout, which can be done by a needle. A process is called as arthrocentesis. Alternative, it can be done by opening the joint. A surgical operation name is called as arthrotomy. Thanks for watching.